Hi guys, today we'll be discussing abnormalities of the heart, specifically arrhythmias and the types of medications used to treat the condition. The heart is composed of 4 chambers, separated by valves to stop backflow. The top chambers are known as the atria and the lower chambers are called the left and right ventricles. Electrical impulses are relayed from the sinoatrial node to the atrioventricular node down to the Purkinje fibers, causing the heart to contract. There are 2 types of cardiac cells. The first are nodal cells, which are pacemaker cells that generate their own action potentials. The second are non-nodal cells, which are cardiomyocytes such as atrial and ventricular myocytes or Purkinje tissue.
Heart electrical signals exist as action potentials, which are dramatic changes in an excitable cell's membrane potential, which can be propagated through adjacent excitable cells. Phase 0 is when fast sodium channels open, causing a large influx of positive charges, depolarizing the membrane. Phase 1 is when potassium channels open, releasing potassium ions and repolarizing the membrane slightly. Phase 2 is when sodium enters and potassium exits the cell somewhat proportionally and the curve plateaus, otherwise called the plateau phase. In Phase 3, sodium channels close, making the potassium channels the dominant ion transporter, repolarizing the membrane potential to about negative 90 millivolts in Phase 4. A second action potential cannot be generated until the previous one is complete, and the time in which a second potential cannot be generated is called the effective refractory period, or ERP. The purpose of the ERP is it allows time for the ventricles to empty and refill before the next contraction occurs. When conduction processes don't function properly, this causes heart arrhythmias. Arrhythmia, also called dysrhythmia, is where the heart beats fast, slow, irregularly, or early. Arrhythmia includes bradycardia, where the heart beats slowly, tachycardia, where the heart beats too fast, fibrillation, or irregular heart beating, and premature contraction, which is an early heartbeat. Arrhythmia can be caused by alcohol abuse, diabetes, drug abuse, overconsumption of caffeine, heart diseases, hypertension, mental stress, heart scarring from a heart attack, and smoking. Arrhythmias can lead to blood clots, resulting in strokes. Bradycardia and tachycardia can also lead to heart failure, where the heart is unable to sufficiently pump blood throughout the body.
Class 1 antiarrhythmics inhibit sodium channels. The classes are further divided into 3 categories. Class 1A drugs inhibit sodium channels at Phase 0, resulting in a longer action potential and effective refractory period. Class 1B drugs slightly decrease action potential duration, increasing their frequency. Finally, Class 1C drugs also block sodium channels. However, they have no effect on the duration of action potentials. Those who suffer from supraventricular tachyarrhythmias, a fast heart rhythm, are advised to take a Class 1A drug, such as disopyramide, which is administered orally in capsule form. Lidocaine, administered intravenously in a 1B drug prescribed to individuals suffering from reduced heart electrical conductivity causing ventricular tachyarrhythmias. Reduced electrical conductivity forms reentrant circuits in the heart, which are alternative electrical circuits, causing tachyarrhythmias. 1B drugs increase the electrical conductivity of damaged heart tissue, correcting impulse conduction in the heart and reducing their flow through reentrant circuits, preventing tachycardia. Supraventricular tachycardia can also be treated with Class 1C antiarrhythmic like Flecainide, which is administered orally. These drugs slow the propagation of action potentials through gap junctions in adjacent cells, returning synchrony between the contraction of the atria and ventricles by spacing them further apart in time.
Disopyramide is a Class 1A antiarrhythmic drug which blocks sodium influx in Phase 0 of the cardiac action potential in atrial cardiomyocytes. This reduces the flow of ions through gap junctions of adjacent cardiomyocytes, taking more time to achieve the depolarization threshold needed to generate an action potential, slowing its propagation. In an electrocardiogram, or ECG, which is a visual representation of the heartbeat, the P-wave and QRS complex duration are increased, prolonging the PR interval. This lengthens the duration of the cardiac action potential emanating from the atria to the ventricles and increases its effective refractory period, making it a fitting drug for treating ventricular tachycardia as this spaces out the heartbeats.
Class 2 anti-arrhythmics are also known as beta blockers. These can be used to treat heart arrhythmias, such as tachycardia, atrial fibrillations, atrial flutters, but not bradycardia. A commonly used beta blocker is Atenol, which is taken orally once or twice a day at 25, 50, or 100 milligrams. Beta blockers function by inhibiting the sympathetic nervous system. The sympathetic nervous system releases norepinephrine, which stimulates receptors on cardiac cells, where the parasympathetic nervous system prevents this excitation with acetylcholine. Beta blockers prevent the action of this norepinephrine by binding receptors. Norepinephrine stimulation induces faster calcium movement into the cell, faster calcium release from a calcium storage area in the cell, known as the sarcoplasmic reticulum, or SR, and faster calcium reabsorption from the SR. The reduced binding of norepinephrine leads to a faster heartbeat due to the chronotropic and inotropic effect. The chronotropic effect is when norepinephrine excites pacemaker cells, enabling a faster phase 4 due to the faster absorption of calcium into the cell. A faster phase 0 occurs due to the more rapid release of calcium from the SR, and a more rapid phase 3 due to the faster reabsorption into the SR. This leads to a shorter time interval between the atrial and ventricular contraction and a faster heartbeat. The inotropic effect is when norepinephrine stimulates cardiomyocytes to have a shorter phase 2, where calcium is released from the SR more rapidly, leading to a shorter absolute refractory period and a faster heartbeat. Beta blockers prevent the action of norepinephrine through competitive inhibition, preventing the inotropic and chronotropic effects from increasing heart rate. There are receptors across the body that bind norepinephrine, which can also be affected by beta blockers, leading to adverse side effects. Many other drugs also interact with the sympathetic nervous system, so beta blockers often have adverse effects when combined with other drugs.
Class 3 antiarrhythmic agents interfere with the potassium channels of the heart to influence the heartbeat. For individuals that possess supraventricular tachycardia and re-entrant arrhythmias, antiarrhythmic drugs such as amiodarone can be utilized. The primary role of potassium channels in cardiac action potentials is to cause cell repolarization. As explained before, phase 3 of the cardiac action potential is the repolarization of the membrane potential. This decline in voltage occurs due to calcium channels being closed and potassium continuing to leave the cell. Amiodarone works specifically at phase 3 of the action potential, lengthening it to change the effective refractory period that exists from phase 0 to 3, the duration which another action potential cannot be generated. Amiodarone interferes with the ion concentrations by binding to and blocking the potassium channels. By blocking these channels, repolarization becomes slower, consequently causing phase 3 of the action potential to become longer, lengthening the effective refractory period. On an electrocardiogram, these changes correspond to an elongated QT interval, meaning it takes longer for the ventricular depolarization and repolarization to occur. Using amiodarone to correct abnormal heart rhythm by lengthening the QT interval can be dangerous, as it can lead to Torsades de Pointes, known as TDP. The side effect is a serious condition that can result in death as it disintegrates ventricular fibrillation, meaning the low chambers of the heart quiver or spasm instead of pumping blood due to unorganized electrical activity, and no blood is circulating the body. Therefore, individuals should not be prescribed class 3 agents such as amiodarone if they already have a long QT interval naturally or are prescribed other medications such as antipsychotics that induce a long QT interval. Amiodarone is most effective when taken intravenously to prevent the time release present when taken orally.
Class 4 antiarrhythmics inhibit calcium channels by decreasing conduction velocity, causing an increased refractory period. That is, the refractory period that is directly after stimulation of an excitable membrane, and a decreased PR interval of the ECG. These drugs also prolong the repolarization of the AV node, increasing the time between action potentials, consequently slowing down an individual's heartbeat. The drugs operate to help treat cardiac arrhythmias including supraventricular tachycardia, atrial fibrillation, and paroxysmal supraventricular tachycardia that consists of a group of arrhythmias that have a sudden onset and termination. Verapamil is a class 4 drug. In cardiac excitation-contraction coupling, myocytes need to be electrically excited to cause the heart to be depolarized, allowing a contraction to occur. Calcium 2+ acts as an essential messenger throughout the entire electrical activity process of the heart, and is also important in causing myofilaments to bind to be able to cause a contraction. Once an action potential has been initiated inside the heart, calcium moves into the cell through calcium channels. The sarcoplasmic reticulum responds by further releasing Ca2+, which allows it to bind to troponin C, causing actin-myosin cross-bridges to form, leading to a contraction. Once a person takes in verapamil, the intracellular concentration of Ca2+ is decreased, which consequently causes a reduction in cardiac muscle contraction. Decreased cardiac contractility means verapamil causes a weakening effect on the strength of cardiac contraction. While verapamil also affects the SA node and the AV node, if someone with a cardiac arrhythmia such as tachycardia takes in verapamil, either through a pill or intravenously, The L-type CA2 plus channels become blocked, causing the generation of action potentials to slightly slow down the conduction at the SA node, slowing down the heart rate, known as negative chronotropy. Negative dromotropy occurs, which is the reduction in conduction velocity at the AV node, causing the generation of action potentials to slightly slow down the conduction of the sinoatrial node, ultimately slowing down the heart rate, which is known as negative chronotropy. Dromotropy occurs, which is the reduction in conduction velocity at the atrioventricular node.
Some of the side effects of the aforementioned drugs include